it pronounces S sound.
S. You want to
F.
say something or
Yeah,
like
F.
F?
Nice. It's big smiling. Thank you. See, we give you a big favor, right? Thanks for being part of.
We go by her overall facial midline, and that's where it is. This is a point where I take a picture for Luke to set the teeth based on that. Then I tell the patient, smile as big as you can. Really, really big. Really, really big. As big as you can. As large as you can. And I go to the lower lip, and I make a line there, okay? The reason I make that horizontal line is because I want to make sure that the teeth are set so that she doesn't have a gummy denture. You know, you see that a lot. You see a gummy denture. That's horrible.
Correct.
I feel really bad for those patients. You want to make sure that they don't have a gummy denture. So you want to make sure that when the teeth set and they come out naturally, and you're not seeing too much gum up here. Okay? So these are the two measurements that you take. From here, I already have a bite. And we're going to take an extra bite. I'll show you how to do that in 1 second, okay? So now we're going to take this out. Follow me. Okay. We're going to open big. Bite down gently again. Close all the way. Normal, normal, normal. We need to replicate that right there, okay? So what I'm going to do is I'm going to have you open. Material right up here. See that? And go ahead and line this. Go ahead and close all the way, just like you did earlier, and lock it like that. Perfect. This is going to harden in 2 minutes, and we'll have a perfect registration for you so that we can set these teeth beautifully, okay? Just relax like that, okay? Keep going. Watch this. Watch this. Look at this.
Nice.
Perfect bite. Perfect bite. See? There we go. Now relax your upper lip. See here, I'm showing 3 millimeters, okay? 3 millimeters from the lip that's relaxed. This is the one that we initially sent, okay? So we have a distance of about 3 millimeters from the edge of the lip, okay? See that right there? I'm seeing 3 mils, okay? On the wax up, when she's even relaxed, I'm getting 9 millimeters. So it's a 5 to 6 millimeter difference where these teeth need to go up, okay? And then also, she can't close. Bite down. She can't close. See, she's forcing to close. She can't close. Got that?
Can I see the lower?
This one?
You want me lower this?
She still has that from the surgery. So.
Ah, I see.
But it didn't hurt that much.
So really, okay, did not hurt.
All right.
Okay, good.
We're good.
Good. All out. So explain the surgery. So happening, right?
Okay, so she went to another office and she came back to us because she couldn't even put in her denture. We had to do an alveoloplasty and reshape her entire lower jaw, which was that should have been done the day that they extracted the teeth. So we had to go back in there, open everything up. She's healing beautifully. She didn't have any discomfort, which surgery like that is, you know, is pretty invasive. But right now, she's healing nice, and we're gonna get that upper and lower denture in. This is the current upper denture. The patient came to us because this looks absolutely nothing like her normal natural teeth. And the other problem that she had was the lower denture she couldn't even wear because it wouldn't even close.
Gotcha.
And she actually had maybe about a 20 millimeter open bite with the lower denture, and she couldn't even close. We have photographs of that, but
Nice.
we're gonna give her a nice denture now.
Yeah.
Yeah, no, she also doesn't like the color on this.
I see.
Like, see, look at the color. Look at what they did here. And this is supposed to be her final.
Nice. So this is wax, like she said. Here is a little bit fat, right? So we're going to decrease a little bit. Right? All right. This
Looks
is
good.
Yep.
Look at that. I mean, so this is what I always make, not this. You see the gums on top? This is no good.
Yeah, no.
The back side gonna be as thin as possible.
But even though she's not comfortable.
Yeah, but we can thin it later. We can thin
Okay.
it, you know.
As long as you can thin it before I leave, like.
I mean, we'll thin it the
We
most.
try. We try.
We'll try to make
We
it
try.
as, you know, I'll try to thin it as much as possible, but I also need room. So the top is good.
That's nice. Right, alright. Okay. Alright, check the bite.
Okay, let's get this one back in here. Right down, close. Okay, so there.
E. Let me grind the lateral too long. Can you take a look at it? So I want to make a little shorter here. You see interference? Make a little shorter.
Okay.
Can you move to like this? Yeah, the other side.
Good.
All right, the other side. Okay.
That's good. She's good. Cool.
Put a little bit more optic glaze with the characteristic after contouring tools. That's nice. Now apply the blue. Get really detailed for between the teeth. Nice. Okay, so after characteristics with the metal mesh underneath and the bleaching teeth color from Ivoclar here. So we're going to try in the patient's mouth soon. Here. This one came from this.
Gonna struggle. She's
You
struggling.
don't have to
There it is.
Nice.
See?
figure out how to like
Look at-
tip
look
it
at-
back in order to get it out.
Look at how realistic this looks. Beautiful.
Just grind a little here and there. Great. Great suction.
Huh?
Nice.
Look.
All right.
That's not going anywhere. Watch this. Watch this. Let's see if you can hear it. Let's see that sound. Yeah, it's right there.
All right, try it lower. Nice. Okay, take it out. Both using two hands. Nice. All right, the try top and bottom is the bleaching color. And how many minutes to get your house?
1 hour and 20 minutes.
1 hour 20 minutes. Don't tell us we finish same day, right?
Mm-hmm.
Pronounce it S sound.
S. You want me to
F.
say something or
Yeah,
like
F.
F?
Nice. It's big smiling. Thank you. See, we give you a big favor, right? Thanks for
Mhm.
being part of the great hours of marketing. And then now you can eat. You don't have to wait another 2 3 weeks, right? Are you happy now?
Right. Oh, I'm extremely happy.
Perfect. That's it.
Mm-hmm. Thank you.
So,
different.
so try.
Good, right?
I love it.
She loves it. She's happy.
Good, good. Thank you. So you recommend Dr. Emilio
Oh, absolutely.
to who?
Right.
To everyone.
Everyone?
She went somewhere. She was not happy with it.